Welcome to my podcast. Today I'm going to talk about another common case that I had in my lab too. So basically, the patient will come to you, and after you introduce yourself, as always agreed, double check the patient name and date of birth, ask the patient, how can I help you today? So the patient might say, I'm having back pain for some time, and it's really affecting my life, affecting my activity, affecting my work, affecting my all levels of my daily activity. So basically, you will tell her or tell him, how can you, or tell me more about the issue. So the patient might say, the pain started a few weeks ago when I was doing something, and it's on and off. Maybe it's lasting longer. So you'll ask the patient if there is any trigger, for instance, if the patient has anything in their mind or any thought that might be the reason for their back pain, if they had done anything to ease the pain, if there is any associated factor. Say, for instance, if there's pain referred, say, for instance, to the bottom or to the back of the leg, or if it's traveling down. So all of that you need to ask, and you need to ask the patient what's the nature of the pain, what's the characteristic. In a grade from 0 to 10, where would you put score yourself, where 0 or 1 is minimum pain, and 10 is the most severe pain that the patient can't to relate. And you need, while asking so, try to put some differentiation in your mind. Say, for instance, if the patient feeling like a muscular pain, so the patient might say it's like a pull or it's like a spasm. If it's associated with a nerve, for instance, the patient might say there's sparking pain or referred pain, and so on. And if there is any history of trauma, you'll ask the patient. If the patient, you'll ask the patient what job do they do. For instance, if there's a lot of manual labor or carrying heavy stuff, and if the patient has any past medical history, for instance, if the patient is elderly and has any diagnosis at all, so for instance, cancer or taking any medication in the long run. And then you'll ask about the allergy and if there's any known family history. And then you will try to encourage the patient to stay active, because sometimes the patient think that if they have back pain or neck pain that they don't need to do any activity, just relax and chill out and sleep. That's not the situation, so you need to tell them that you need to keep active and move around. Also, you can advise to put frozen peas and wrapped towel, put it around the pain to minimize and reduce the pain and the swelling if it's associated with. You can give them anti-inflammatory medication like ibuprofen or paracetamol. It could help, but mostly it's anti-inflammatory like ibuprofen, Voltaren. And if it's acute, you will ask the patient to put, say for instance, the hot water bottle wrapped in a towel as well, in order to avoid burning the skin, or heat pad around the area, which alleviate and minimize the stiffness of the muscle or the muscle spasm, and give some warmth to the area, which could help in the relief of the pain. And ask them also to do minimum stretches in order to mobilize and ease the pain. And as I say, avoid staying in bed or staying inactive, because of that won't help or improve the situation. And also, you need, after examining the patient and telling the patient to put their finger where about the pain exactly, you will safety net them, that if the patient doesn't go away, if it's getting worse, if the patient have sudden numbness or paresthesia, if the patient lose power of the urination or defecation, All of that should warrant coming to the A&E or to seek their GP immediately for further advice. And also, if the patient is not coping with the pain or struggling to cope, they need to come back and seek further advice. Also, if the patient starts, for instance, bumps and lumps and started to lose weight, for instance, in a few months' time, or if there's, as I say, subtle paresthesia or high temperature, all of that, it's a red flag for something sinister that the patient need to come to their doctor. However, in most of the cases, it's not something very sinister, so you need to tell the patient that they need to keep active by trying to be mobile, trying to stretch their muscle, and give some some advices that can help them with the pain. Say, for instance, you will try to explain to the patient that they need to adopt a good posture and maintain proper posture when they are sitting or standing or walking, because if there is any poor posture for the spine, this will cause some strain in some area, which could cause muscle spasm, pulling, and this will occur in pain in the long run. Also, the patient, because we agreed that we need to ask the patient what sort of work they do, we need to advise that try to avoid staying in still position for quite a long time. So if you are sitting all the time, or if you are standing all the time, but if you're professional, try to take a small break in order to move, stretch the body, and walk around, and try to alternate between them. If you are in a position where you need to lift heavy object, try to bend with your knee and hip, and not lean forward, and then strengthen your legs and move the thing with the core muscle rather than bending in an incorrect way, which could cause strain and, of course, pain. Also, you need to do some sort of the exercise which could strengthen the back and the core muscles, say, for instance, like swimming, yoga, walking, Pilates. All of that support the muscle of the spine and reduce the risk of the pain. Also, instruct the patient, if they are overweight or obese, to lose those extra weight and try to eat healthy in order to keep the body with the healthy weight and with the healthy food that's needed for the body. Another thing that you need to make sure that the patient can have sleep, proper sleep, which is basically 7 to 9 hours per night, and to have a supportive mattress that can be supporting for the back and the neck. It's usually advisable. The mattress should be firm in order to support the body and allow comfortable sleep. And if the patient prefers to sleep in the side, it's advisable to put a pillow between both knees to create a better alignment for the spine. And in such a situation, there will be no strain, which could exert too much pressure and pain on the back. If the patient is stressed, for instance, try to advise that they need to try to avoid any stressful situation and try to breathe deeply and try to meditate and also do yoga and deep inspiration and prolonged expiration. All of that, it's helpful to relax the muscle and minimize spasm, which could cause pain. Also, if the patient is wearing, for instance, high heels and most of the time standing, better to avoid this because this will cause strain also in the muscle and the tip of the toes, and this will throw the weight and cause malalignment for the spine and the lower back, which cause pain. So it's better to avoid high heel and wear supportive footwear, whereby the patient and the spine will feel more at ease rather than strained. Also ask about lifestyle of the patient, what sort of eating do they eat, what sort of activity do they do, and if they are a smoker, for instance, because smoking is well known to hinder blood supply and perfusion to the tissue on the spine and the disc. All of that will cause, of course, issue, and this will add to the muscle spasm and pain because of the lack of the essential blood perfusion to the muscle. So by that, I hope that I just touch upon some of the main points or the tips that you can take into consideration if you face a patient with back pain, in order to address the main points that to be tackled in order to reach to the issue and try to solve it in a smart way. Thank you.